In a move that has sparked intense debate and raised serious health concerns, the Gympie Regional Council has voted to remove fluoride from its water supply, marking the second such decision in Queensland within a year. But here's where it gets controversial. While the council claims this will save ratepayers $255,000 annually, health experts argue it could lead to long-term dental health issues, particularly for children. And this is the part most people miss. The decision reignites a broader discussion about whether local councils should have the authority to make such critical public health choices. The Gympie Regional Council's decision comes after more than a year of internal debate and 15 years of fluoridating the region's water. In 2012, Queensland granted individual councils the power to decide on water fluoridation, a move that has since divided communities. Earlier this year, the Cook Shire Council in far north Queensland also voted to remove fluoride, and the Cairns Council opted not to reintroduce it. Of Queensland's 77 local government areas, only 23 still fluoridate their water, though most of the state's population remains covered due to the entire southeast region's fluoridation. Mayor Glenn Hartwig defended the decision, stating that fluoridation had led to a 0.5% rate increase. If the state wants it mandated, they should fund it, he said. Hartwig also emphasized the importance of respecting differing opinions, noting, "We're not catering to conspiracy theorists. We're having a democratic conversation." However, this stance has drawn criticism from health professionals who argue that fluoridation is a proven, cost-effective measure for preventing tooth decay. University of Queensland dental expert Michael Foley was sharply critical, calling the decision a no-brainer gone wrong. He highlighted that fluoridation saves significantly more in dental treatment costs than it costs to implement. Almost every other town and city in Australia outside Queensland drinks fluoridated water, Foley pointed out. This should be a state government responsibility, as it is in every other Australian state. Foley expressed frustration with the Queensland government's reluctance to address the issue, stating, "It staggers me that this isn't being prioritized. The debate isn't just about costs. It's also about trust in science." Gympie councillor Alona Lan argued that locals should have a choice about what's in their water, citing countries like those in Europe that don't fluoridate. The science isn't settled, she claimed, drawing parallels to past controversies like smoking and asbestos. "We need to consider if it's as safe and effective as we're told." Lan said she conducted her own community consultation, claiming overwhelming support for the removal of fluoride. But is this decision really in the best interest of public health? Opposition leader Stephen Miles warned that the consequences could be dire, particularly for children. "Fluoride is one of the most cost-effective public health interventions," he said. "If Gympie's children end up with rotten teeth, I'll hold Premier David Crisafulli accountable." Miles criticized the 2012 decision by the Newman government to leave fluoridation to local councils, though he acknowledged that Labor didn't reverse it during their nearly 10 years in power. Deputy Premier Jared Bligey, part of the former Newman government, defended the council's autonomy. "Local governments represent their communities and should make these decisions," he said. However, Miles countered that the $255,000 savings pale in comparison to the potential costs of poor oral health. Queensland Health should step in and fund this, he urged, encouraging Gympie Council to reconsider. Residents are divided. Hazel Watts expressed shock, stating, "Fluoride is essential for children's teeth, especially with dental costs so high." Meanwhile, Ann Robertson praised the decision, calling fluoride a carcinogenic chemical byproduct and filtering her water to avoid it. The council must now give residents 30 days' notice before beginning the $100,000 decommissioning process, expected to be complete by June next year. So, what do you think? Is removing fluoride a wise cost-saving measure or a risky gamble with public health? Should this decision rest with local councils or should the state take control? Let us know in the comments. This debate is far from over.